Good day, I'm Pearl Angel Sabao from PSN 1B, and today I will be performing or demonstrating the proper hand washing and hand scrubbing. So the purpose of this procedure is first to reduce the number of microorganisms on the hands, and then to reduce the risk of transmission of microorganisms to the client, to reduce the risk of cross-contamination among clients, and lastly to reduce the risk of transmission of infectious microorganisms to oneself. To begin with, first we will do the assessment of the patient. We will determine the patient for any presence of factors increasing susceptibility to infections and any possible undiagnosed infections such as HIV. We will also assess the patient for its use of any use of immunosuppressive medications, its recent diagnostic procedures or treatments, such as those who are penetrated the skin or the body cavity, and lastly, we will assess the patient for its current nutritional status. And then after that, we will do the planning, in which we need to carefully plan the location of the running water and the soap or the soap substitutes. After that, we will also assemble the equipment needed, which is the soap, a water or a warm running water, a disposable or sanitized towel, or a paper towel. After that, we will now proceed to the implementation, in which we will assess ourselves. We will check or make sure that our nails are kept short. And then we also need to assess for any jewelries like wristwatch, rings or bracelets, and remove them before doing the procedure. Okay. And then we will also need to check our hands for any breaks in the skin, such as hangnails or cuts. So make sure that if a patient or a client sees you when doing this procedure, introduce yourself first, and then discuss or explain to the patient why you are doing the procedure and what are you gonna do and why is it necessary. After that, we will now proceed to the hand washing proper. We have 5 types or 5 different kinds of faucets or handles, which is the hand-operated handles, the knee lever, the foot pedal, the elbow control, and the infrared control. So in my situation or in my case, I will be using the hand-operated handle, which is commonly used in homes or houses and in hospitals. So to begin, first we will need to turn on the water and be sure to adjust the flow of the water to make sure that the water is warm. And then we will wet our hands and wrists thoroughly by holding them under the running water. Hold your hands lower than your elbow so that the water from your arms will flow to your fingertips. Apply soap to your hands. If you are using a liquid antimicrobial soap, then use 4 to 5 ml of it or 1 teaspoon. And if you're using a bar soap, granules or sheets, rub them firmly between your hands. Thoroughly wash your hands and rinse it afterwards. Use a rubbing or firm rubbing and a circular motion to wash the palm, the back, and the wrist of your hand. Be sure as well to include the heel of the hand, and then interlace your fingers and thumbs and move them back and forth. The World Health Organization recommends the following step. First, the right palm over the left dorsum with fingers interlaced, and vice versa. And then palm to palm with fingers interlaced. And then the back of the fingers to the opposite palm of the hands with fingers interlocked. And vice versa. And then rotational rubbing of the left thumb clasped in the right palm of the opposite hand and vice versa. Continue this motion for at least 30 seconds. And then be sure as well to rub the fingertips against the opposite palm of the opposite hand and vice versa. And then rinse your hands thoroughly in the running water. After that, thoroughly dry your hands and your wrist. Use a clean paper towel or a sanitized towel and disposable towel to dry your hands and your wrist by patting it and not scrubbing it. And then dispose the used paper towel on the appropriate container. Use another towel, which is also clean, to pat dry the other hand. And then dispose the paper towel to the appropriate container as well. Turn off the water by using another paper towel and then grasping the handle. And then discard the used paper towel as well after doing it. Make sure that your hands are properly clean and then dried. Now, I will demonstrate you the proper hand washing or the hand scrubbing before any sterile skills. First, turn on the water and then let your hands thoroughly. Using the water. And then, wet the scrub brush and apply a liberal amount of antimicrobial soap and lather it well about 2 inches above your elbow. Hold your hands higher than your elbow and let the water flow from your fingertips down to your arms or your elbow so that the hands become cleaner than the elbow. Use or in a circular motion, scrub all the surface of your one hand and your one arm. Start with the fingertips. Scrub at least 10 strokes of each of nail. And all sides of fingers. turn both sides of the hand. After that, scrub your arm. Use 10 strokes to scrub each of the lower, middle, and the upper part of your forearm. And then, after that, rinse the scrub brush and then reapply the soap or the antimicrobial soap, and then repeat the scrubbing to the one hand or to the other hand and to the arm. Normally, this procedure will take 2 to 6 minutes. And then rinse your arms and the hands. Rinse your hands thoroughly. Be sure that you will be not leaving any trace of soap. After that, dry your hands and your arms. Use a clean towel or a disposable paper towel to pat dry your hands in a circular motion from the fingertips to the elbow. And then discard to the appropriate container the used paper towel, and then use another clean paper towel for the other hand. And then discard it again to the appropriate container, and then turn off the water by grasping the handle of the hand-operated handle. And then discard the towel again after using, and before touching any unsterile items, be sure to apply sterile gloves and make sure that your hands are properly clean and properly dried. So for the evaluation, ensure that your hands are clean and properly dry. Now I'm done demonstrating the proper hand washing and hand scrubbing, and that's it for today. Thank you.